Welcome to Mountainside Medical Center's Introduction to Cardiac Catherization. Here we will introduce you to what a cardiac catheterization is, how to prepare for it, and what is expected before, during, and after the procedure. During a cardiac catheterization, a thin flexible tube called a catheter is inserted into a blood vessel and advanced up to the heart. A cardiac catheterization can be used to examine your arteries or heart valves, or just to measure how well your heart is pumping. You will meet with your doctor prior to talk about the procedure and receive any special instructions that you might need to follow. You may have to stop taking some medications ahead of time, especially if you have diabetes or take blood thinners. You'll be asked not to drink or eat after midnight the night before the procedure. If your instructions include to continue taking certain medications, for example, your blood pressure medications, you may do so with a small sip of water. Be sure to tell your doctor if you have any allergies to any medications, iodine, or shellfish. It's important for your doctor and the clinical hospital staff to know what medications you take. So make sure to bring a list of medications, dosage, and any herbs or supplements that you may be taking. It is very important to ensure that you have a designated driver to take you home after the procedure. You will not be able to drive yourself that day. When you arrive at the Harry's Pavilion ground floor, you will check in with registration, and they will send you to the same-day medical department on the first floor. You will be asked to remove all your clothes and don a hospital gown. To prepare for the procedure, nurses will apply cardiac monitors, check and mark your pulses, and clip your groin hair where the catheter will enter. The nurse may also clip hair on the wrists if the doctor or the physician performing the procedure plans on going through the wrist. You will have an IV placed before the procedure. This time during preparation is a great opportunity to ask the nurses if you have any additional questions. A cardiac catheterization usually takes about an hour. You will be moved from the stretcher to the catheterization table in the procedure room. You will see a large C-arm near the bed. That is an X-ray machine the physician will use during the procedure. You will be lying flat, but we can provide a pillow for you. It is a hard, narrow table, but we will make you feel as comfortable as possible. You will be monitored the whole time. A sterile drape will be placed over your body, and you will feel the cool cleaning solution on your wrist or groin. Your doctor will place a short plastic sleeve called a sheath into the blood vessel. The catheter is then inserted through the sheath and threaded up through the vessel to the heart. The tips of the catheter measure pressures inside the heart. Contrast dye is injected through the catheter into the coronary arteries under X-ray. This allows the physician to clearly visualize how well blood is flowing through the arteries and helps identify any areas of plaque or blockages. While the dye is being injected, you may feel warmth through your chest. If you're in the cath lab for a treatment procedure, that will happen at this point. If your catheterization is purely diagnostic, the doctor will remove the catheter and sheath. The access site might be closed with internal absorbable closure device or suture. Pressure might be held at the site to help prevent bleeding. If your wrist artery was accessed, a transradial band will be applied to the wrist like a bracelet to hold pressure. You will be transported out to the cath lab to recovery area. If your groin was the area used for access, you will be laying flat for 4 to 6 hours to help prevent bleeding. Bending the knee on the affected side or sitting up too soon creates pressure that can disrupt the puncture and cause bleeding or hematoma. A nurse will be checking your vitals, pulses, and access site at frequent intervals to monitor your status. Try to relax, and we will take care of whatever you need during this time. After a catheterization, make sure you drink plenty of water. Water helps the kidney flush the contrast dye used during the procedure out of your system. You may always ask our care team any questions you may have. We want you to feel at ease in our facility, knowing that you are in great hands. It's a privilege to take care of you.